Welcome back to the Fire of Truth podcast. I'm James Kerr. Today, I just wanted to talk about therapy in general. It's one of those things that, it's not easy to talk about in the tattoo industry, or I think probably anywhere, really. So I just kind of wanted to give you guys my view on what therapy is and how awesome it is. Because just full disclosure, I see a therapist once every 2 weeks. And I have been for the last couple of years. And I have quite a history with therapy and therapists in general. My first exposure to therapy was through my mom. And she had suppressed some pretty rough memories in her childhood for a long time. And then when she was about 36 years old, it came out in a dream and pretty much explained why she had been going through all the anxiety and depression that she went through her whole life. So she started seeing a therapist. I'm not sure how old I was. I was I was about 12 years old actually, because you'll find out. So she was at her therapy session, and she brought my sister into the session with her, and my sister was drawing some stuff on a piece of paper. And I'm not exactly sure what she was drawing, but it must have been pretty telling because my mom's therapist was watching her draw and then immediately looked at my mother and asked my mom, "Is there abuse going on at home?" And of course, my mom had to say yes, because there was. And it makes me uncomfortable talking about it, but I think it's important to talk about. So my mom's therapist told her that he was legally bound to intervene and stop it, but gave her a chance and basically told her if she didn't stop the abuse at home, then he would have to step in and take my sister and I and away from them. And so that was the spark that finally ended the physical abuse at home. And so my mom mustered up the courage. I don't know how she did it. But she did. Her fear of losing us outweighed her fear of making my father angry. And so, to my father's credit too, it was in that moment when my mom gave him the ultimatum. He decided to stop drinking, stop doing all the drugs, and he ignored us for about a year when he put his nose in a Bible for a year. And about the same time, my school counselor ambushed me. It was, I don't know, maybe a month later. I don't really remember the timeline here. This is a crazy time for me. I basically was called from one of my classes and, called to the office, and I had to go to the office. And when I went to the office, I was ushered into the school counselor's office, and she was there. Her name is Georgie Ann. I love her. She passed away at this point, but yeah, at the time I didn't love her. But when I got into her office, my mom and my sister were both there. And so it was like an episode of intervention, And basically they told me, Georgie Ann, the school counselor told me that I had been abused. What was going on at home was called child abuse. And that if I didn't seek help and I didn't do something about it, that I would be repeating it in my own family. They taught me about what the cycle of abuse was at the time. And now I don't remember much more beyond that. I just know that I felt like I got stabbed in the back by my mom and my sister. And because I knew they were right, and there's some instinct in me that knew all along, of course, because I had tried to run away multiple times. And there's a story for another time, but we're talking about therapists here. And I essentially got so pissed off, and I just walked out of the office. They let me go. I don't remember anything about what happened after that. I don't remember about where I went. But yeah, it was at that point that I knew that, if I did have a child, that I was not going to do the same thing that happened to me. And um, it was around that same point I started smoking cigarettes, started smoking marijuana. And fucking couple years later, I started using methamphetamines. And the methamphetamines that I started using at the age of 14 inevitably landed me overdosing and collapsing on the sidewalk, on the streets, getting medically intervened with, and then ending up in a mental hospital, the local one here called Sempervirens, and encountered some more therapists, in the unit. And the first time I went to Sempervirens, I got diagnosed with amphetamine delusional disorder. And, it was fairly accurate. I was having delusional thoughts, thinking I was Jesus and all this kind of stuff. Like thinking I was, doing missions for the aliens and all that. It's a whole different topic that we're probably going to talk about, definitely going to talk about in this podcast at some point. And then, so the second time, I went back to Hoopa, where I grew up, lived with my family for 9 months, and I was so far gone, like I didn't know how to put my own pants on and that kind of thing. Didn't know how to have conversations with people. I started to recover, and then I moved back out from my parents' house about 9 months later, immediately got back into methamphetamines again. 4 months later, I was back into the mental hospital, but this time I got put into a halfway house, a transitional, it's called the TRTF program, the Transitional Residential Treatment Facility. So it was basically, I had to do day treatment at the mental health facility grounds there. So it was 5 days a week. I saw a therapist, and I needed to. And it was during that time that I got diagnosed with schizophrenia, paranoia, and post-traumatic stress disorder, and generalized anxiety disorder. There was a dual diagnosis because I was a drug addict. I was addicted to methamphetamines, and I also had all the symptoms. I was the right age. I was like 19, 20 years old. The right age when schizophrenia came out. I have family history of schizophrenia. My uncle on my mom's side has it. So I spent 5 days a week going to individual therapy sessions, group therapy sessions. There was this class called Interpersonal Effectiveness that I did once a week, and it was basically like how to have a conversation with people. Like that's how far gone I was. And I was in that system for about a year and a half, maybe 2 years, and I got out of the halfway house and put into a satellite house, which is satellite house was still part of that program, but I was able to live on my own. And during that time, I was by myself, and I must have cried every day in that place. It was not fun at all being by myself and just having this whole like, oh man, I am insane and there's no hope for me. And, calling my mom, wanting to come home, and her sticking to her guns, telling me that I can't come home until I am clean for long enough. And man, that was a super difficult time. But so the therapy that I went through was good, and I needed it. I went to NA and AA. I was required to by the program, that was a big deal. But I inevitably ended up back on methamphetamines again, and it was around that time that once I went back to the mental hospital again. It was shortly after that I had met, or shortly during that time that I met the person I'm married to now. I've been married to for about 27, 28 years now. And a lot of things have happened since I had a kid, and when my wife got pregnant, I you know, for something kicked in. I was still on SSI for the schizophrenia, though I wasn't hearing voices anymore. I wasn't having delusional thoughts anymore, and I wasn't like, seeing things. I, wasn't hallucinating. And when my wife got pregnant, something kicked in me, and I was like, well, I'm not gonna. It was the whole thing that my school counselor said, well, you're going to repeat the cycle of abuse if you don't do something. So I went into this mode of, I'm going to do the exact opposite of what my dad did. And, I grew up on welfare. And so I was like, I'm not going to take free money. So I went to the Social Security office and I told them, like, I want to get off of this. I'm not crazy anymore. And so they had me see a psychiatrist. And then, I answered some questions, and questions like, who's the president of the United States? You see an envelope on the ground. It's got a stamp on it. It's got an address, but it's unmarked. It hasn't been processed. What do you do with the envelope? So apparently when I was in a mental hospital, I didn't answer those kind of questions correctly. But yeah, so I got a clean bill of health. I don't have schizophrenia. And I think when I got the diagnosis of schizophrenia, they didn't have a diagnosis called amphetamine-induced schizophrenia, which is probably what I would have been. It's closer to the amphetamine delusional disorder thing that I got diagnosed with. And the diagnosis is essentially just like, a group of words that kind of help doctors assess the right kind of treatment. A diagnosis isn't who you are. And that's one of the things that I learned from my therapist early on was, when we thought I had schizophrenia, which is justified because I had the right symptoms, I had the history and all that. He told me that I am not a schizophrenic. I am a person with schizophrenia. So it's something that I've kind of carried over to now. Like I still deal with PTSD and stuff like that, but my diagnosis isn't my identity. It's not like when I have a headache that I am a headache. No, I'm a person with a headache. Same thing with PTSD or anxiety or any of that. I am not my diagnosis. We are not our diagnoses. We are people with these certain ailments that people have labeled, that professionals have labeled with good reason, so they know how to treat us as patients, And, I started seeing a therapist when my father passed away, or when he was dying, and I'm still seeing him. And it's been very helpful to me to have a professional now that I can trust, that I can, use as a mirror, that's been helping me. And I want to continue seeing him. And I know for a lot of people going through trauma, and this, myself included, trusting someone is impossible. In fact, you can go even deeper and say trust in and of itself, it doesn't happen. When you have what's called faulty neuroception, which happens whenever you get abused, like your nervous system gets wired for danger. And so as we get older, you start perceiving danger when you're safe. And that's what a panic attack is. And then the other side of faulty neuroception is you start feeling safe when you're in danger. And that's why people stay in abusive relationships, because it's familiar. It's the devil you know. And I think for me, therapy has been awesome, even when I didn't want it. And like looking back on it now, my son is 24. I didn't hit him. Hooray. And if we ask him, I may ask if he wants to come on the podcast here, because that would be awesome. When I ask him, he says I did a pretty good job. So I want to go with that. And, yeah, so that's my take on therapy. I'm still doing it. It's still helpful. And I've learned to trust, and I've learned that when I'm in danger, that's when I'll respond to the danger. And when I do have a panic attack, which means that I'm detecting danger when there isn't any, I just lean into it now, and I try to be friends with my anxiety, because my anxiety is just trying to keep me alive, and it comes from those times when I was in danger and I needed to be hypervigilant, and I needed to modify my authentic self in order to survive. I don't need to do that anymore. So, heavy topic, but I appreciate y'all listening. Next episode's probably going to have a guest. Don't know who it's going to be. I'm not telling. But thank you guys so much for listening. And much love to all you.